Well, just to let you know, astigmatism is one of the commonest diagnoses eye doctors talk about every day. You might be surprised that you have some level or degree of astigmatism, but you might not know because one, you have not gone to get your eyes checked. Secondly, it might not be affecting your vision at the moment because it is just little or nothing at the moment. But even at that, you always have to get your eyes checked because, like I said earlier, even the least level of refractive error, when ignored, can worsen with time and be a problem or a call for concern. So, you always have to get your eyes checked whether you have symptoms or not. Even in the absence of any symptoms, at least you have to get your eyes checked 3 times in a year. So let's go to the simplest definition of astigmatism. In a very simple term or definition, astigmatism is a condition in which some of the structures in our eyes that are involved in image formation are not perfectly round or perfect in their normal shape, which will definitely lead to bending of light during image formation, and this will, at the end of the day, lead to blurry or distorted images. Some of the structures in our eyes, especially the outer part of our eye that are involved in image formation, is the cornea, which we already know and which we can see part of it from the outside. So in a situation whereby the curvature of the cornea is not perfect, a normal cornea is supposed to be perfect in curvature, it's supposed to be perfectly round, but in a situation whereby there is irregularity in the curvature of the cornea, this is when astigmatism sets in. Instead of light to be focused at the right point, they are more or less scattered, and this will definitely lead to blurry or distorted vision. Like I told us earlier, eye problems can be refractive or pathological. In the case of astigmatism, the good news is that it is a refractive case. So it can be corrected, it can be managed. It is not a disease. That means it is not pathological. Now, when you talk about astigmatism in respect to the cornea, a normal cornea is supposed to be perfectly round in shape. There is no irregularity in a normal cornea. That means when light falls on the cornea, they are focused at the right spot. And this is the more reason image formation will always be clear, definite, and accurate. But in an eye with astigmatism, the cornea is not perfectly round. The surface of the cornea, which is supposed to be perfectly round, is distorted, is uneven. It is not perfect. It is irregular in shape. So when light falls on the retina, they are more or less scattered in different directions. And at the end of the day, this will lead to a kind of image that is distorted or blurry. Well, just to refresh your memory, the cornea is the front part of the eye, which does not only protect the eyes but also help to focus light at the right point at the retina during image formation. So when the surface of the cornea is perfect or curved perfectly, it helps to focus light at the right spot on the crystalline lens, which leads to perfect image formation. But in a situation whereby the surface of the cornea is irregular, the light focusing will be scattered. The focusing of light will not be at the right spot, which will lead to distorted or blurry images. On the other hand, when we talk about the causes of astigmatism, it has to do with the type of astigmatism. So when we are talking about the causes of astigmatism, it simply has to do with the curvature of either the cornea or the crystalline lens. Because talking about the types, we have cornea astigmatism and lenticular astigmatism, which has to do with either the cornea or the crystalline lens. So in the case of cornea astigmatism, it has to do with the curvature of the cornea surface. If the surface of the cornea is perfectly round, then there is no astigmatism in such eye. But in a situation whereby the curvature of the cornea is irregular, light will keep on bending, light will keep on scattering instead of being focused at the right spot on the crystalline lens. On the other hand, when you talk about lenticular astigmatism, it has to do with the lens. The shape of the crystalline lens, the positioning and all that can cause astigmatism. So talking about the type of astigmatism, we have two major types: cornea astigmatism and lenticular astigmatism. Talking about the cause, it has to do with the curvature, the shape of either the cornea or the crystalline lens. Still on astigmatism, what are the symptoms of astigmatism? Number one, like I mentioned earlier, blurry of vision. Vision is always blurry. It is always distorted because lights are not focused at the right spot on the crystalline lens. What is another symptom? What other symptoms can you notice in an astigmatic eye? When someone that has astigmatism wants to read, you notice that they always bring the material, the book or whatever they are reading, closer to their eyes. What other symptoms of astigmatism can we talk about here? Astigmatism. Astigmatism is stress. When you stress your eyes so much. In an astigmatic eye, you have to put in a lot of work to be able to see object from afar or probably read. So you put in a lot of work, you stress your eyes, and at the end of the day, you feel the pain in your eyes. What other symptoms can we talk about? When you look at something in an astigmatic eye, objects are more or less elongated. They are not normal. Apart from being blurry or distorted, objects are elongated. The shape of the object is not normal. It is elongated. So this is the more reason why you need to visit your eye doctor and get your eyes checked to know if you have even the least level of astigmatism. Once again, astigmatism is not a disease but a condition, a refractive error that can be corrected. But in some cases, it can be referred as a disease, and that is what we are going to talk about: the implication of astigmatism. Astigmatism can lead to something we call keratoconus when the cornea start to bulge out, especially in a situation where there is high level or degree of astigmatism as a result of negligence, as a result of the fact that nothing is being done about it. Like I said earlier, the least level of refractive error, if left untreated or unattended to, it can worsen with time. So a high level of astigmatism can lead to bulging of the eyeball, and this is what we call keratoconus. The eyeball looks more bulged, it bulges out like a cone. Another situation or implication is a situation whereby the surface of the cornea starts to thin out. Remember, the surface of the cornea, the curvature is supposed to be perfect, but in an astigmatic eye, it is irregular. And when it starts to thin out, this is a call for concern, and we can refer to it as a disease and not just a condition or refractive error. So these are the implications of astigmatism? Well, if you already have some kind of refractive error, but you are not sure which type of refractive error you have, and probably you must have watched this video, the commonest or simplest way for you to know if you have astigmatism is to ask your eye doctor about your corrective lens prescription. If you get a hold of your corrective lens prescription and you see anything that has to do with axis or seal, if you see any of these or both of them in your prescription, just know that you are astigmatic and your corrective lens prescription has been made to take care of your astigmatism. Then we'll go to the eye care tip and management of astigmatism. The most commonest way to manage or take care of astigmatism is by the use of corrective lenses, prescription lenses. Your eye doctor will do the necessary tests and let you know the power that will take care of your level or degree of astigmatism. You can also go for contact lenses that will also be of help. And as well, we also have the surgery, the lesser aspect of it. So these are the three options. So when you discuss with your eye doctor, you know the best option that is suitable for you. But the commonness is the use of corrective lenses, prescription lenses, glasses to correct astigmatism. Remember, no level of astigmatism should be ignored. Before we come to the eye health question of the day, I believe by now you should be able to define astigmatism or at least have a knowledge of what astigmatism is all about, the definition, causes, types, symptoms, implication, management. So, do you know anyone that has astigmatism or are you astigmatic? How have you been managing it? Have you been going for your checkup? Let us know in the comment section. If you are watching me for the very first time and you would like to learn more by eye health, kindly click on the subscribers button. You can as well like, comment, and let me know your observations after this video. If you also have some area of eye care or eye health that you would like us to talk about, let me know in the comment section. This is Eye Care Tip, Dr. Phil, Dr. Eye Care Tips. On this channel, you will learn a lot about the eye, vision, and eye care tips for the best of eye health. Stay tuned. Don't go nowhere. Don't forget to subscribe. We have a lot of video coming your way. Thank you.